Well, good afternoon, and welcome to the Global Pain Association's virtual education series. This is the 10th in our weekly series of programs that are designed to help people struggling with chronic pain, their families, and loved ones. We know across this country, literally millions and millions of people deal on a daily basis with pain that simply won't go away. One way to look at it is intractable pain, chronic pain, every day, every night they deal with it. And through the Global Pain Association, we hope to provide hope, help, and an opportunity to relieve that pain. I want to let you know that this virtual pain education series is presented by the nonprofit organization Global Pain Association. It comes to you every week, every Saturday at noon on the Global Pain Association Facebook page. Today's topic, COVID-19 in summer 2020, with nationally known epidemiologist Dr. Anil Mangla. The program is brought to you by the Alamo Area Council of Governments. They are today's sponsor. The Alamo and Bear Area Agencies on Aging, the AAA, have collaborated with Texas Health and Human Services Commission to address opioid misuse among adults 60 years and older. Free doTERRA drug deactivation kits are available to dispose of expired prescription opioid medications. Proper disposal safeguards older adults as well as the environment. Now, they also have available some neat little swag, magnets identifying various types of opioids, along with a local telephone number for substance abuse resources. And by the way, if you're interested in obtaining that kit, all you have to do is call 210-477-3275. 210-477-3275, or toll free 866-231-4922. Now, we're delighted to have you with us, and we'd like to welcome on board Dr. Susan Blackwood. Dr. Blackwood is the founding member and creator of the Global Pain Association. It was her concept, her initiative, her contacts that have put together this amazing group. Dr. Blackwood joins us, and we're delighted to see her. Susan, every week we talk a little bit about what was your motivation for the Global Pain Association, and we've talked some about professional and amateur athletes who you have seen at the highest level who wake up every morning in pain. How do they deal with that?
Well, Ron, good morning and happy 4th of July, and thanks to the Eisenberg Group and you as our moderator each week putting this series together. We certainly know of people in our community and in the athletic realm that suffer from pain. We have teens, college students, college athletes, and all of them need resources, their families, their caregivers, people that are working with them on a day-to-day basis. And we've loved putting this series on. We've had so many positive remarks about people that have been helped through the series. And our board recently voted to keep the series going for the rest of the summer. So thank you again, and to ACOG for making this week's possible.
And we're going to keep you going as well. We'll come back to you toward the end of today's program and let folks know how they can become active with the Global Pain Association, how they can support you both through their expertise and monetarily. All that is coming at the end of today's program. And Dr. Susan Blackwood, great to see you, and I'm sure you're going to enjoy hearing from Dr. Mangla. So we're going to move Susan off to the side. We're delighted to have all of you with us. Dr. Anil Mangla, many of you are familiar with him. He was the epidemiologist here in Bear County with Metro Health. He's now the epidemiologist in Comal County and was chief epidemiology and assistant director of health for the San Antonio Metro Health. He was director of public health and associate professor of biomedical research at the University of the Incarnate Word School of Osteopathic Medicine. He served as lead epidemiologist for the states of Indiana and Georgia. And while with the city of San Antonio, he led the response during H1N1, Zika, Ebola, and Chikungunya, among other epidemics that hit our community. He's also the board chair for the Texas Kidney Foundation and was a recent, as he has talked about it, kidney recipient. And he is looking great, by the way. It's a delight to see you, Dr. Mangla. Thanks for joining us.
Thank you very much, Ron. It's a pleasure being here, and I look forward to the interview.
Well, you've put together some very informative slides and a presentation that is going to bring us up to date on where we are with the norovirus and the summer of 2020. Tell us, first of all, what is the current situation here in Texas?
So the situation looks very bleak and very grim, not just in Texas, but the rest of the country. Our numbers in Texas are surging, and we are breaking single-day records with our positive cases jumping from one day to another. And that's concerning. So now we actually rank fourth highest in the country when it comes to COVID cases. The red zone that we look at is, as a matter of fact, we call it the doubling time. Our doubling time prior to the Memorial Day and the reopening was about 32 days.
Now, I think we have a couple slides that show what we were talking about here.
So, our doubling time was almost 32 days initially prior to the opening, which the arrows will be showing. But we are now in a red zone, which means if your doubling time is less than 18 days, you are in absolute spread of disease. And we right now are almost, at between 10 days and 8 days. So this is a significant move in the wrong direction for Texas. So I see zero signs of slowdown if we are not going to follow the public health regulations and rules as we move forward from the 4th of July.
Now, one of the things we're all interested in is the question of age. When we first began talking nationally about the pandemic, we were led to believe if you are over age 65, like me, you're the ones at risk. If you are under 30, hey, no big deal. It turns out not true. Tell us, what are the trends in age groups who are becoming infected?
So let's go to slide 1, and I'll kind of explain where we've seen this major difference. It's the trends we're looking at right now. And if we look at the trends, what has happened is once we had a phase 2 opening, which was opening of bars as well as restaurants, and if you look at that graph, if you look at 14 days after the opening, which is actually the incubation period, you can see the significant increase in the number of cases. So what's the driving force? The driving force, like you brought up, is the age demographic. So if we look at age, like you mentioned, there's been a significant change when it comes to the dynamics of age. If we're looking at age, I'm going to give you 2 really good examples. And the slide on age will clearly identify for the audience where we stand on this. So
you want slide 3.
So anyone that actually, if you look at slide 1, this is just a change within 3 weeks. When you're looking at 3 weeks of change, if you look at June 2nd, the age group of 19 to 29, we had about 5% of the individuals that were COVID positive. Look at the change now. We have almost a change of 520% within that population. But look at the change in individuals that are 60 and above. They have decreased by 71%. So why is that? And when you look at this data carefully, is the ages 19 to 29 have taken it for granted that this is over. They are going to be fine. They will not get any of the COVID infections, and they're starting to group together. They're starting to have parties. They're avoiding their 6 feet distance between them. They're avoiding masks. And as we know, this disease is very contagious, and it's actually getting these numbers up within that population.
Dr. Mengele, what is a test, and where do you get one? And does everybody need a test?
Yes, so that's a significant question you bring, because there's a lot of confusion between increasing testing and positivity rate. So if we look at, I drew up a really current slide on one of the counties looking at the increase in testing and looking at the increase in positivity rate, which is slide 2. Now, when we look at that, testing is important for many, many reasons. Number one is the testing is going to identify individuals that are positive. Now, you could be asymptomatic. And so if you're asymptomatic, you're going to get a test and the test is going to show you positive. However, many individuals are asymptomatic. So how do you show an individual who's asymptomatic, is in public, is in the community, and has no idea they're positive, yet they're very contagious and they're starting to spread the disease? So the only way we're going to identify the individuals that are positive, asymptomatic, are the ones that get tested, we isolate them, they become non-contagious, and they're back in the community. So the spread decreases. But let me talk a little also while we at testing and while we at test, the importance of a positivity rate. So there's a big misunderstanding and a myth of as we increase testing, we increase positivity rate, which is absolutely not true. In epidemiology, we use the positivity as a measure of the spread of disease. Now, if you look at this chart that I have, and you look at the black line, it's going down since March. However, if you look at the graph, the ones in blue, you can see the number of cases are going up. So why are those going up when positivity is going down? That's a good sign. A good sign of positivity going down means we actually containing the spread, and the spread is decreasing. You can see between the two arrows, that's when we started phase 2, a partly opening of restaurants and bars within the community and other businesses. That positivity rate almost stabilized, right? It stabilized at about 3%. And then when we had the phase 3 opening, as you can see from arrow 2, we started getting a significant increase in cases, but also positivity rate. So normally with epidemiology, a good number for positivity rates is below 5 or 6. And I use 6 for our purposes here. Anything above 6 means a significant spread of disease in the community. And right now, some of our counties and, around us, Bexar County, Comal County, Guadalupe County, we're all hitting almost 12 to 13%, and some are hitting 20% positivity rates, which means out of every 100 tests you have performed, 20 people are positive, which is significant, and that is showing us why our spread is becoming severe and uncontrollable here in Texas.
One of the things that confuses people is the difference between quarantine, self-quarantine, staying at home, what's official, what do we need to protect ourselves, how long we need to quarantine. Bring some sense to that, Dr. Mangla.
Yes, so those are terminologies I think everybody needs to get used to, because this is what you hear in the news. And, the idea of understanding what each of those mean is going to be important. So when someone tests positive, they will be isolated. And the isolated period is normally 10 days. Once they recovered, that means become asymptomatic, they are non-contagious and continue to work or be part of the community, and of course still wear masks, which I'm going to come to later. Now, a quarantine is an individual that's not positive, but was a direct contact to a positive. So there's two different circumstances there. Number one, you could be a contact with somebody at work or in the community or at a party. The other contact could be a household contact, right? Household contacts are very high risk. Now, when we talk about the quarantine period, the quarantine period of an individual who is let's start with the easy one, non-household. A non-household quarantine individual or a contact will begin their quarantine period for 14 days after they have completely been isolated from the positive case. So assume someone at work was positive, they went home. So that's the day you have been isolated from the positive, and your 14-day quarantine starts from there. Quarantine is a very key component of stay home, do not travel, uh, and follow the protocols that are provided by public health for that 14 days being at home. So now we know what quarantine is. Now let's look at a household quarantine, which works very different. So if you're a household quarantine or contact, your quarantine period also is 14 days. But if you look at the first line I have in this chart, your quarantine period will only start once your family member has recovered from their 10 days. So if a family member is positive, they go through their 10 days, now they recovered, meaning that they are not contagious. Your quarantine period starts 14 days after their recovery. So that's the difference between the isolation and quarantine, and also the difference why some people have a longer period of quarantine compared to others. So it's, again, this is got to be, it's not a cookie cut 14 days and 10 days. It's actually more tailored towards the case that is positive and their
Well, let's bring this back to people with chronic pain. And the Chronic Pain Association, our virtual pain series, try to help those folks. Are there people who have chronic pain, have compromised immune systems, who may be at greater risk to struggle with this virus?
Oh, absolutely, Ron. I mean, when you're looking at individuals that are immunocompromised, we fall into two different categories there. The first category is our older adults, right? So they have a poor immune system, number one, due to age. Number two, they may have underlying health conditions, and the underlying health conditions would increase their risk significantly because of COVID, since the body can fight the virus as well as the other healthy individuals, which also are struggling right now regarding COVID. So number one is the older adults. Number two are people with, like I said, the medical conditions. And we have a list of some of this. This is not the entire list, but it gives you an idea. Individuals that have kidney disease, lung disease, you're looking at liver disease, COPD is another one. You're looking at individuals with transplants. Obesity rates is also a major one. We're looking at, blood disorders. We are looking at individuals that may be pregnant. We are looking at where it's really focused towards us here in South Texas is diabetes. I mean, in San Antonio, we have almost 1 in 3 that are diabetic. So there's a very high risk of those individuals becoming high risk categories. So talking of high risk, what do people actually need to look out for? What type of signs and symptoms are really important in these cases? Now, like I mentioned, between almost 20% of these cases have been asymptomatic. So they have no idea that they are even positive unless they get tested. That's why, again, I stress, it's never, end of testing. Testing should increase substantially and continue all the time. So the symptoms that we really look at, and these change, I mean, this is such a novel virus, these change on a monthly basis almost, is a fever. The number one, because this is a respiratory disease, it affects your lungs. The key symptom people are going to see is shortness of breath. Because of shortness of breath, you're going to start seeing a lot of cough, a runny nose, sore throat. But the key one that we have identified that when we conduct these case investigations, almost 80% of individuals that I have interviewed have kind of showed some sign of loss of taste and smell. And as a matter of fact, that's the last symptom that actually comes back. But, these are very similar to a cold and flu. However, the shortness of breath is kind of the alert for people that may have COVID.
Now, if someone has some of these symptoms, should they get tested?
Absolutely. It's not going to hurt to get tested, because the longer you take to test, and if you are positive, the more individuals you're going to be infecting. So testing is the primary reason that we can actually mitigate this disease and actually stop people from getting infected due to its contagiousness.
Now, do PCPs have access to these tests now?
Absolutely. And it's a good thing you bring the idea about tests, because there's many different tests in the community. So the three important tests are, number one, it's a PCR test, which is a gold standard. And so the cons about, you have the pros and cons. The cons about it is it takes almost 48 hours to a week to get that result. The other test we have is known as an antigen rapid test. It's a very accurate test. I mean, it's very specific. And if you're positive, you're positive. And many are using that test because the advantage of it is you're going to get your results within 15, 20 minutes. But the disadvantage of that test is if you test negative, you may have a false negative. So we're going to be careful how to interpret that. And the third one is called the antigen antibody test. And that tells you if you have a current or a previous infection. And we normally regard the antigen test and the antibody test as probable positives. However, we treat them as a real positive.
Now, if you get a negative test result, you have to assume it may not be accurate. So therefore act as if it is present, the disease?
Yeah, I mean, well, that's what an antigen test. The other, right. If you get a negative, you can be rest assured you may be negative.
Exactly.
Yeah.
Now, I want to take just a moment before we have to say goodbye to you. First of all, we want to thank you so much for your time and expertise. In your role in Comal County as the chief epidemiologist, what are the top questions you're getting, and what are the answers?
Well, the questions I'm getting, I think the number one question that I normally get is, how can I avoid or how can I decrease my risk of COVID-19? And I think I have a slide on transmission that would kind of suggest some very important points of what we have learned and what we need to do. So if you look at the transmission, we have now clearly identified a few things. Transmission will only occur, or transmission actually occurs by few routes, now, of few modes. Number one, your transmission is going to happen while you're talking. Number two, while you're sneezing, while you're coughing, and when you exhaling. So we know already the modes of how someone's going to get the disease or how it's going to be transmitted. So since we know this, according to my 15 years of experience, I know we can prevent this disease 100%. Knowing already the routes of transmission, we can start thinking of prevention orders. So the next slide is giving you an idea of what we need to do. And we need to do this as a community, not just individuals. And if you look at the next slide, it gives you three important areas to cover, because those are the only routes we have where someone can get infected. Number one is distance, right? Make sure you have a 6-foot distance between one another. And if you look at the first slide, if you're having physical physical distancing between one another, let's say the 6 feet distancing, your chances of that intervention, your chances of decreasing the risk is almost 80%, right? If you wear masks, it's almost about 80 to 82%. And if you wear eye protection, your risk decreases by about 60%. So think of it. If you think of that numbers, I mean, if both individuals wear these masks, eye protection, distancing, your risk is going to decrease to almost less than 5%. That's a major accomplishment of getting this disease mitigated. Now, let me talk of the experience that other countries have proven regarding this. And if you look at the next map, it'll show you countries that did not have masks and countries that implemented masks way early in February, January. And you can see how their graph looks where, there was no peak. There was almost a tapering from the beginning of the pandemic. So masks work. So this is really proof that other countries that have implemented initial masks have had a significant low amount of prevalence in their countries. And finally, to look at, people are talking of distancing and people are talking of lockdown. Why is that important? So I have a graph or a illustration showing mathematically why that is important. Now, this is also bringing up another thing about comparing flu and COVID. So if you look at the last slide, what this tells you is in the COVID, so there's two things to remember here. When we look at disease, we look at contagiousness, or it's called the reproductive number, which is called R0 or R0. Now with the flu, that number is 1.3. For COVID, we're using 2.5. What this tells you is one person can infect 2.5 individuals, right? So if you look at the first in this slide, if you look at the top, where there's absolutely no social distancing or lockdowns, one person in 5 days is going to infect 2.5 people, 1 to 2.5. Within a month, that one individual could have already infected 406 individuals, just one person. Now look at the second one. If we decrease the exposure to about 50% of the population, if we do that, one person in a month is only going to infect 15 individuals. Now compare where 400 is and 15. But if you have a stay-home order for 75% of the population, so this is a shutdown where only key individuals are at work, that one person in that month is only going to infect 2.5 individuals. Now think of this spread. It's so exponential that we can actually contain it very quickly. And the way to contain it is knowing the way the transmission is regarding this disease, which is very clear. Close your, cover your mouth, your nose, have a eye protection, and your risk will go down substantially.
All right, we got to stop right here, Dr. Mangler. We thank you. Wear your mask, social separation. Thank you. We'll talk with you again, Dr. Neil Mangler, epidemiologist. I'm going to remind folks, if they just joined us, today's series is brought to you by the Alamo Area Council of Governments. The Alamo and Bear Agencies on Aging, AAA, have collaborated with Texas Health and Human Services Commission to address opioid misuse among adults 60 and over. Free Deterra drug deactivation kits are available to dispose of expired prescription opioid medications. Proper disposal safeguards older adults as well as the environment. Additionally, magnets are available identifying types of opioids along with a local telephone number for substance abuse resource. And if you want those materials, here's the number to call, 210-477-3275. It is on your screen. And toll free, 866-231-4922. And thank you to Dr. Mangler for joining us. I want to bring back Susan Blackwood. Dr. Blackwood is here with us as the really the founding force behind the Global Pain Association, our 10th program now in terms of looking at another way we can discuss global pain, and the coronavirus is now in the can, as they say. And Dr. Blackwood, for folks who want to get involved, who want to help, how do they do that?
Well, first of all, Ron, it's clear with our presentation today, we need to protect our chronic pain patients in the community by being safe and wearing our mask and keeping our distance. It's really important as they suffer with some of their issues. But thank you so much again for moderating this, and to ACOG for supporting us, and other people that would like to support us. It's very easy. We want these series to continue. So if people want to make a donation, they can go to www.globalpain.org/get-involved/donate. And every dollar helps. Thank you.
Well, we thank you, Dr. Blackwood. And for folks who have participated in today's program, we've got another one coming up next Saturday, July 11th at noon, right here on Facebook. The topic, supplements and chronic pain. Our presenters, Dr. Pendleton Wickersham and Dr. Marianne Pinkston. So next week, tell a neighbor, tell a friend, anyone who's interested in not only global pain, but chronic pain and intractable pain. Can supplements help? We talk supplements and chronic pain. Thank you all for joining us on behalf of the Global Pain Association. I'm Ron Aaron Eisenberg. Have a great day, everybody. We'll talk to you next Saturday at noon on the Global Pain Association's Facebook page. And as they say, Elvis has left the building. Or maybe not.